Describe the standard precautions necessary for infection control in a radiography department. How do these precautions impact patient safety and staff protocols? Answer. Standard precautions are essential practices to prevent the transmission of infections in healthcare settings. They include hand hygiene, practicing thorough hand washing or the use of alcohol-based hand sanitizers before and after patient contact, personal protective equipment (PPE), utilizing gloves, masks, gowns, and eye protection based on the expected exposure risk, respiratory hygiene, encouraging patients to cover their mouths when coughing and using tissues, safe injection practices, avoiding the reuse of syringes and ensuring proper disposal of needles in sharps containers. These precautions enhance patient safety by minimizing the risk of healthcare-associated infections, highs ensuring that staff remain healthy and capable of providing care and complying with regulatory guidelines, such as those outlined by the World Health Organization, WHO, and the Australian Commission on Safety and Quality in Healthcare. What techniques should be employed for effective patient education before radiographic procedures? Provide an example of how inadequate preparation can lead to complications. Answer. Effective patient education involves clear communication, explaining the procedure in simple language and ensuring the patient understands the purpose and what to expect, written instructions, providing brochures or handouts that outline preparation steps, potential risks, and post-procedure care, informed consent, ensuring the patient understands the procedure's risks and benefits and obtains their consent before proceeding. For example, if a patient undergoing an abdominal X-ray is not instructed to avoid eating for several hours prior to the procedure, the presence of food in the digestive tract may obscure diagnostic details, necessitating repeat imaging. This not only increases patient exposure to radiation, but can also delay diagnosis and treatment. Explain the importance of proper positioning techniques in radiography and discuss the factors that can influence patient comfort during these procedures. Answer. Proper positioning techniques are critical in radiography for several reasons. Image quality. Correct positioning ensures that the area of interest is adequately visualized, which is essential for accurate diagnosis. Reduction of artifacts. Proper alignment minimizes motion artifacts caused by patient movement, leading to clearer images. Factors influencing patient comfort include communication. Clear explanations of each step can alleviate anxiety and help patients feel more secure. Physical support. Providing pillows or supports can help maintain comfort, especially for patients with mobility issues. Temperature control. Adjusting the room temperature can make the environment more pleasant. Moreover, the radiographer must assess any physical limitations or conditions that may affect positioning and adapt accordingly, ensuring both safety and comfort. Mr. Smith is a patient in the intensive care unit, ICU, requiring a chest X-ray. Discuss the considerations Mr. Smith's radiographer should keep in mind while performing mobile imaging. Answer. The radiographer should consider the following when performing mobile imaging on Mr. Smith. Patient stability. Assess Mr. Smith's current medical condition and ensure he is stable enough for transport or imaging. Equipment setup. Prepare mobile imaging equipment in advance to minimize time spent in the ICU, reducing exposure to other patients and maintaining the sterile environment. Infection control. Follow strict infection control protocols, including the use of PPE and ensuring equipment is disinfected before and after use. Positioning and comfort. Ensure Mr. Smith is positioned comfortably while accommodating any medical devices, e.g., ventilators, IV lines connected to him. By addressing these factors, the radiographer can successfully obtain the required imaging while prioritizing patient safety and comfort. Outline the importance of quality assurance in radiographic imaging. What specific guidelines should be followed to ensure optimal equipment performance? Answer. Quality assurance is vital in radiographic imaging to ensure that image quality, consistently high-quality images are produced, which is essential for accurate diagnosis, patient safety, reducing the risk of unnecessary radiation exposure due to malfunctioning equipment, regulatory compliance, meeting standards set by organisations like the Radiological Council of Australia and ensuring adherence to Australian Radiation Protection and Nuclear Safety Agency Answer. Guidelines. Guidelines for QA include routine maintenance, implementing scheduled checks for equipment functionality including calibration and performance evaluations, performance testing, using phantoms and standard test patterns to evaluate image quality and equipment reliability, documentation, maintaining records of all QA activities and results to track performance trends and identify areas for improvement. Discuss the indications and contraindications for utilizing MRI in clinical practice. What specific considerations should a radiographer keep in mind when preparing a patient for an MRI scan? Answer: MRI is indicated for soft tissue evaluation, effective in visualizing brain, spinal cord, and soft tissue abnormalities. Joint imaging, useful for assessing ligaments, tendons, and cartilage. Contraindications include metal implants. Patients with certain metal implants, e.g., pacemakers, some aneurysm clips, may face risks due to the strong magnetic field. Claustrophobia. Patients with severe anxiety about enclosed spaces may require sedation or alternative imaging modalities. When preparing a patient for an MRI scan, the radiographer should obtain a thorough history, inquire about any implants or medical devices that could interfere with the MRI, educate the patient, explain the procedure, addressing any concerns about noise and duration of the scan. How does cultural competence influence patient interactions in radiography? Provide examples of strategies that radiographers can implement to enhance their cultural sensitivity. Answer: cultural competence is crucial in radiography as it affects patient trust, understanding, and cooperation. It involves recognizing and respecting diverse backgrounds, beliefs, and health practices. Strategies to enhance cultural sensitivity include training and education, participating in workshops on cultural competence to understand various cultural beliefs about health and illness, tailor communication, adapting communication styles to fit the patient's cultural background, possibly using interpreters when necessary, inclusivity in care, being aware of and accommodating cultural practices that may affect imaging procedures such as preferences for modesty or the presence of family members during exams. By integrating these strategies, radiographers can improve patient experiences and outcomes while fostering a more inclusive healthcare environment. Describe the key considerations involved in performing angiography. What protocols must a radiographer follow to ensure patient safety during this procedure? Answer: angiography involves imaging blood vessels and requires specific considerations. Pre-procedure assessment: conducting a thorough assessment of the patient's medical history, including allergies, e.g., iodine and renal function. Informed consent: ensuring the patient understands the procedure, its risks and benefits, and obtaining consent before proceeding. Protocols for patient safety during angiography include sterile techniques: maintaining a sterile environment to prevent infections at the catheter insertion site. Monitoring vital signs: continuously monitoring the patient's vital signs during the procedure to detect any adverse reactions immediately. Post-procedure care: providing instructions for monitoring the insertion site for bleeding or swelling and advising the patient on activity restrictions post-procedure. Adhering to these protocols minimizes risks and enhances patient safety. Discuss the ethical implications of patient consent in radiographic procedures. What best practices should radiographers follow to ensure informed consent is obtained? Answer: informed consent is a fundamental ethical principle in healthcare, ensuring patients are fully aware of the procedure and its implications. The ethical implications include autonomy, respecting the patient's right to make informed decisions about their care; trust, building a trusting relationship between the patient and healthcare provider. Best practices for obtaining informed consent include clear explanation, providing a detailed explanation of the procedure including risks, benefits, and alternative options; opportunity for questions, allowing patients to ask questions and providing clear, understandable answers; documenting consent, ensuring that consent is documented appropriately in the patient's medical record. By adhering to these practices, radiographers can uphold ethical standards while ensuring that patients are adequately informed. Analyze the operational principles of different imaging systems and discuss how troubleshooting common equipment issues can enhance diagnostic accuracy. Answer: different imaging systems, e.g., X-ray, CT, MRI, operate on distinct principles, such as X-ray uses ionizing radiation to create images based on tissue density. CT combines X-ray data taken from different angles to produce cross-sectional images. MRI utilizes strong magnetic fields and radio waves to generate detailed images of soft tissues. Troubleshooting common equipment issues is crucial to maintaining diagnostic accuracy and involves regular calibration, ensuring equipment is properly calibrated to prevent image distortion; identifying artifacts, recognizing common artifacts, e.g., motion blur, and addressing the underlying causes such as patient movement or equipment malfunction; equipment maintenance, performing routine maintenance checks to prevent breakdowns that could compromise patient safety or image quality. By implementing effective troubleshooting techniques, radiographers can significantly enhance diagnostic accuracy and patient outcomes. What are the legal implications of patient information protection in radiography, and how do they relate to the concept of patient confidentiality? Answer: in radiography, patient confidentiality is governed by laws and regulations such as the Privacy Act 1988 (CTH) in Australia, which mandates the protection of personal information. Radiographers must understand that all patient information, including images and reports, is considered sensitive and confidential. Legal implications: breach of confidentiality. Unauthorized disclosure of patient information can lead to legal consequences, including fines and civil suits. Informed consent. Patients have the right to know how their information will be used, shared, and stored, which is integral to obtaining informed consent. Access to records. Patients can request access to their medical records, and radiographers must ensure compliance with these requests while safeguarding sensitive data. Understanding these legal aspects ensures that radiographers respect patients' rights, maintain confidentiality, and comply with professional ethical standards. What are the key elements of valid informed consent in radiography, and why is it ethically significant? Answer: valid informed consent in radiography requires the following key elements. Competence. The patient must have the mental capacity to make informed decisions regarding their care. Disclosure. The radiographer must provide adequate information about the procedure, including risks, benefits, alternatives, and potential outcomes. Understanding. The patient must comprehend the information provided, which may require the radiographer to assess the patient's level of understanding actively. Voluntariness. The consent must be given freely, without coercion or undue influence. Ethical significance. Obtaining informed consent is ethically significant because it respects the autonomy of the patient, allowing them to participate in their own healthcare decisions. It also helps build trust between the patient and healthcare provider, which is crucial in clinical practice. Furthermore, failing to obtain valid informed consent may result in ethical violations and legal repercussions. Mrs. Smith is a 70-year-old patient scheduled for a CT scan. She expresses concerns about the potential risks associated with radiation exposure and is hesitant to proceed. As the radiographer, how should you address her concerns while ensuring she understands the necessity of the procedure? Answer: in addressing Mrs. Smith's concerns, you should provide clear information, explain the purpose of the CT scan, the expected benefits, and how the information gained from the scan is essential for her diagnosis and treatment. Discuss risks and benefits, outline the specific risks associated with radiation exposure in a clear manner, including any mitigations in place, using the lowest possible radiation dose. Encourage questions. Invite her to ask questions and express any further concerns, ensuring that she feels heard and valued in the decision-making process. Assess understanding. Check her understanding of the information provided and confirm that she is comfortable with proceeding before obtaining consent. Document the interaction. Record the discussion, her concerns, and the information provided to ensure compliance with ethical and legal standards. This approach not only addresses her immediate concerns but also adheres to the principles of informed consent and patient autonomy. What role do ethical decision-making frameworks play in resolving ethical dilemmas faced by radiographers? Answer: ethical decision-making frameworks serve as structured approaches for radiographers to analyze and resolve ethical dilemmas. They typically involve the following steps: identify the ethical issue, recognize the conflict or dilemma that necessitates ethical consideration, gather relevant information, collect all pertinent facts including legal and ethical standards, patient wishes and clinical context, evaluate options, analyze possible actions in light of ethical principles such as beneficence, non-maleficence, autonomy, and justice, make a decision, choose a course of action that aligns with ethical principles and professional guidelines, reflect on the outcome. After the decision is implemented, reflect on the outcomes and the decision-making process to improve future ethical considerations. These frameworks guide radiographers in making well-reasoned decisions, thereby enhancing their professional practice and ensuring adherence to ethical standards and regulations. Explain the significance of continuing professional development (CPD) in radiography and the potential consequences of neglecting it. Answer: continuing professional development (CPD) is critical in radiography for the following reasons. Staying current. CPD ensures that radiographers keep up with advancements in technology, techniques, and best practices in the field. Enhancing skills. Engaging in CPD helps radiographers enhance their competencies, leading to improved patient care and outcomes. Meeting regulatory requirements. Many professional organizations, such as the AIR, require members to undertake a certain number of CPD hours annually to maintain their registration and membership. Consequences of neglecting CPD: reduced competence. Without ongoing education, radiographers may become outdated in their knowledge and skills, compromising patient safety and care quality. Professional sanctions. Failure to meet CPD requirements can lead to disciplinary actions from regulatory bodies, including loss of licensure. Discuss the essential skills and competencies required for the practice of radiography and how they align with professional standards. Answer: essential skills and competencies for radiography practice include technical proficiency. Radiographers must possess advanced technical skills to operate imaging equipment safely and effectively. Patient care skills. Radiographers should demonstrate compassion, communication, and empathy to ensure a positive patient experience. Clinical judgment. The ability to assess situations critically and make informed decisions regarding imaging procedures is vital. Adherence to safety protocols. Understanding and implementing radiation safety measures to protect both patients and staff is paramount. Interprofessional collaboration. Effective communication and collaboration with other healthcare professionals enhance patient care and outcomes. Alignment with professional standards. These competencies align with professional standards set by organizations such as the AIR, which emphasizes the importance of clinical skills, patient-centered care, and adherence to safety protocols in radiography practice. This alignment ensures that radiographers provide high-quality care while upholding ethical and professional standards. Mr. Thompson is a radiographer who is approached by a colleague who asks him to overlook some safety protocols during a busy shift to expedite patient throughput. What should Mr. Thompson do in this situation, considering ethical and professional standards? Answer: in this scenario, Mr. Thompson should prioritize patient safety. Mr. Thompson must recognize that patient safety is paramount. Overlooking safety protocols poses significant risks to both patients and staff. Communicate concerns. He should explain to his colleague the importance of adhering to safety protocols, citing relevant guidelines, e.g., Assens 4260, 1997 for radiation safety. Report the issue. If the colleague insists on bypassing safety measures, Mr. Thompson has an ethical obligation to report the situation to a supervisor or the appropriate authority within the institution. Document the interaction. He should keep a record of the conversation and any relevant details, ensuring there is a formal account of the request. By taking these steps, Mr. Thompson upholds ethical standards, protects patient welfare, and reinforces the importance of safety protocols in radiographic practice. What are the key ethical principles that guide radiographers in their professional practice? Answer: the key ethical principles guiding radiographers include autonomy. Respecting patients' rights to make informed decisions regarding their care, including the right to refuse treatment. Beneficence, acting in the best interest of the patient by providing beneficial care and minimizing harm. Non-maleficence, the principle of do no harm ensures that radiographers avoid causing physical or psychological harm to patients. Justice, ensuring fair and equitable treatment of all patients, regardless of background, while advocating for their rights. Confidentiality, protecting patient privacy and ensuring that personal health information is kept confidential. These ethical principles serve as the foundation for decision-making in radiographic practice, guiding radiographers in providing high-quality, patient-centered care. Analyze the importance of professional organizations, such as AIR and RANZCR, for radiographers and the benefits they provide. Answer: professional organisations like the AIR, Australian Institute of Radiography, and RANZCR, Royal Australian and New Zealand College of Radiologists, play a crucial role in supporting radiographers through advocacy. These organisations advocate for the profession, ensuring that the voices of radiographers are heard in policy discussions affecting healthcare and imaging practices, resources, and education. They provide access to continuing education opportunities, professional development resources, and networking events that enhance radiographers' skills and knowledge. Standards and guidelines. Professional bodies develop and maintain standards for practice, ensuring that radiographers adhere to ethical and professional benchmarks. Career support. Membership offers job placement services, mentorship programs, and professional recognition, enhancing career opportunities for radiographers. By being involved in these organizations, radiographers can stay informed about industry developments, contribute to the advancement of their profession, and access essential resources for their practice. What are the implications of not adhering to professional standards and ethics in radiography, and how can radiographers mitigate these risks? Answer: failing to adhere to professional standards and ethics in radiography can result in several implications. Legal repercussions. Non-compliance with laws and regulations, such as the Health Practitioner Regulation national law, can lead to legal actions against the radiographer or their employer. Professional disciplinary actions. Radiographers may face disciplinary actions from regulatory bodies, including suspension or loss of registration. Reputation damage. Breaches of ethical standards can damage the reputation of the individual radiographer and the healthcare institution, leading to a loss of trust among patients and colleagues. Mitigation strategies. Regular training, engaging in ongoing education and training to stay updated on professional standards and ethical guidelines. Ethical reflection. Radiographers should routinely reflect on their practice, assessing situations for ethical implications and making informed decisions. Consultation with peers. Seeking advice from colleagues or supervisors when faced with ethical dilemmas can provide valuable perspectives and support. Describe the protocols necessary for routine quality control assessments in radiography. What techniques can be used to evaluate image quality effectively? Answer. Routine quality control assessments are essential to ensure that radiographic systems produce high-quality images consistently. The protocols for these assessments include daily and weekly checks, performing visual inspections of equipment and ensuring that all systems are functioning correctly. Calibration checks of imaging systems to maintain accuracy. Phantom imaging, using phantoms test objects to simulate various imaging scenarios. Common phantoms include the CT number calibration phantom and resolution test phantoms. These phantoms help in measuring the imaging system's response to various exposures. Metrics evaluation, employing metrics such as modulation transfer function, MTF, noise and contrast to noise ratio CNR to evaluate image quality. This quantitative analysis aids in determining the system's performance and identifying areas that may need enhancement. By establishing and adhering to these protocols, radiographers can maintain optimal image quality, ensuring accurate diagnosis and effective patient care. What steps should be taken to assess the performance of radiographic systems, and how can areas for improvement in imaging processes be identified? Answer. To evaluate the performance of radiographic systems, the following steps should be taken: routine performance testing, conduct tests on imaging systems to assess factors such as spatial resolution, contrast resolution, and dose efficiency. Use standardized tests and benchmarks to compare current performance against established norms. Data collection and analysis. Collect quantitative data from the tests performed and analyze trends over time. Identify deviations from expected performance metrics that may indicate underlying issues. Comparison with quality standards. Compare the collected data against regulatory standards set by organizations such as the Australian Radiation Protection and Nuclear Safety Agency (ARPANSA). Any performance that falls below these standards should be documented and investigated. Implementation of corrective actions. Identify specific areas for improvement based on the analysis. Implement corrective actions such as recalibrating equipment or modifying imaging protocols to enhance overall imaging processes. These steps will help ensure that radiographic systems operate effectively, thereby improving patient outcomes. Identify common imaging artifacts in radiography, their causes and strategies for resolving these technical problems. Answer. Common imaging artifacts and their causes include motion artifacts, cause patient movement during the imaging process; resolution strategy, instructing patients to remain still and using faster exposure times to reduce motion blur; grid lines, cause improper use or alignment of grids in the imaging chain; resolution strategy, ensuring proper alignment of the grid with the radiation beam and verifying grid usage protocols; chemical artifacts, cause inadequate processing of films or improper chemical concentrations in developing solutions; resolution strategy, regularly checking chemical levels and adhering to the manufacturer's guidelines for chemical preparation and processing techniques. Discuss the importance of incident reporting in radiography. What processes should be followed to analyze incidents to prevent recurrence? Answer. Incident reporting is crucial in radiography for several reasons. Enhancing patient safety. Reporting adverse events helps identify potential risks, contributing to a safer clinical environment. Quality improvement. Analyzing reported incidents allows for the identification of systemic issues that may need addressing. The processes for analyzing incidents include data collection. Gather detailed information regarding the incident, including the context, personnel involved, and outcomes. Root cause analysis (RCA). Conduct RCA to determine the underlying causes of the incident. This may involve interviewing staff, reviewing procedures, and analyzing equipment performance. Implementation of corrective actions. Based on the findings from the RCA, implement corrective actions, which may include staff retraining, procedure modifications, or equipment upgrades. Follow-up evaluation. Monitor the effectiveness of the corrective actions and adjust strategies as necessary to mitigate future incidents. By adhering to these processes, radiography departments can foster a culture of safety and continuous improvement. Explain the methods for collecting and analyzing patient feedback in radiography. How can this feedback be utilized to enhance service quality? Answer: collecting and analyzing patient feedback is vital for improving service quality in radiography. Effective methods include surveys and questionnaires, distributing surveys after imaging procedures to gather patient insights about their experiences, utilizing both open-ended and closed-ended questions to capture qualitative and quantitative data, focus groups, conducting focus groups with patients to discuss their experiences and gather in-depth feedback on service quality and areas for improvement. Feedback analysis, analyzing survey responses and focus group discussions for common themes and trends. Quantifying feedback, e.g., satisfaction ratings, to assess overall patient satisfaction levels. Implementing changes, utilizing feedback to identify specific areas for improvement, such as communication strategies, wait times, or staff interactions. Training staff based on the feedback received and adjusting protocols to better meet patient needs. By systematically gathering and analyzing patient feedback, radiography departments can enhance service quality and patient satisfaction. What principles underlie evidence-based radiography, and how can clinical guidelines be developed and implemented? Answer: evidence-based radiography emphasizes the integration of the best available evidence with clinical expertise and patient values. Key principles include critical appraisal of evidence, evaluating research studies and clinical trials to determine their validity and applicability to clinical practice, incorporation of clinical expertise, considering the knowledge and experience of radiographers when applying evidence-based practices in specific clinical contexts, patient-centered care, ensuring that patient preferences and values are integrated into the decision-making process. To develop and implement clinical guidelines based on these principles. Literature review. Conduct comprehensive reviews of existing literature to identify evidence-based practices relevant to specific radiographic procedures. Collaboration with stakeholders. Involve radiographers, clinicians, and patients in the development process to ensure guidelines are practical and relevant. Continuous evaluation and updates. Regularly assess the impact of implemented guidelines on patient outcomes and update them based on new evidence or changes in practice. By adhering to these principles, radiography can enhance the quality of care delivered to patients. Mr. Thompson, a radiographer, notices an increasing number of patient complaints regarding the quality of imaging services provided at his facility. He is unsure how to address these concerns effectively. What steps should Mr. Thompson take to identify the root causes of these complaints and implement necessary improvements? Answer: Mr. Thompson can take the following steps to address the concerns effectively. Collect data. Gather quantitative and qualitative data related to patient complaints. This can include survey results, direct feedback, and incident reports. Analyze trends. Identify common themes in the complaints, e.g., wait times, image quality, staff interaction. By analyzing the collected data. Conduct a root cause analysis. Utilize RCA techniques to determine the underlying reasons for the complaints. This may involve consulting with staff, reviewing operational protocols, and examining equipment performance. Engage staff in solutions. Involve the radiography team in brainstorming sessions to discuss potential solutions to the identified issues. This collaborative approach can foster a sense of ownership and accountability. Implement changes. Based on the analysis and staff input, implement necessary changes such as staff retraining, revised procedures, or upgraded equipment. Monitor and evaluate. After implementing changes, monitor patient satisfaction levels and continue to solicit feedback to assess the effectiveness of the improvements. By following these steps, Mr. Thompson can systematically address the complaints and enhance the quality of imaging services at his facility. What are the key regulatory requirements that radiographers must adhere to, and how can compliance be ensured in daily practice? Answer: radiographers must comply with various regulatory requirements, including radiation safety regulations, adherence to guidelines set by ARPA, NSA, and local regulatory bodies to ensure radiation safety for patients and staff, infection control protocols, compliance with infection control measures, including proper sanitization of equipment and adherence to hand hygiene protocols, continuing professional development, CPD. engaging in CPD activities to maintain competence and stay updated on the latest practices and regulations in radiography. To ensure compliance, regular training, conduct regular training sessions for staff on regulatory requirements and best practices in radiography, audits and inspections, implement routine internal audits and inspections to ensure adherence to regulatory standards and identify areas for improvement, documentation and reporting, maintain accurate records of compliance activities, training sessions, and incident reports to demonstrate adherence to regulatory requirements. How can the effectiveness of clinical guidelines in radiography be evaluated, and what metrics should be considered during this evaluation? Answer: the effectiveness of clinical guidelines can be evaluated through the following methods. Outcome measures assess patient outcomes related to the implementation of guidelines, such as diagnostic accuracy, patient satisfaction, and complication rates, compliance rates. Measure the degree to which staff adhere to established guidelines in clinical practice. High compliance rates typically indicate effective implementation. Feedback from staff and patients. Collect qualitative feedback from radiographers and patients to gauge perceptions of the guidelines' practicality and effectiveness. Benchmarking. Compare performance metrics against established benchmarks or standards from authoritative bodies in radiography to assess areas of strength and those needing improvement. Continuous quality improvement (CQI). Utilize CQI processes to continuously monitor the implementation of guidelines and make necessary adjustments based on feedback and outcome measures. By systematically evaluating the effectiveness of clinical guidelines, radiography departments can enhance their practices and ensure high-quality patient care. Discuss the role of evidence in clinical decision-making within radiography. How does it influence patient care and practice standards? Answer: evidence plays a critical role in clinical decision-making in radiography by informed decision-making, providing radiographers with the latest research findings, allowing them to make informed choices about imaging techniques and patient care strategies. Standardization of practice. Establishing evidence-based protocols helps standardize practice across facilities, ensuring consistency in patient care and imaging quality. Improved patient outcomes. Utilizing evidence-based practices has been shown to improve patient outcomes, such as reduced radiation exposure and enhanced diagnostic accuracy. Guiding professional development. Evidence informs continuing education and professional development programs, ensuring that radiographers remain knowledgeable about best practices and advancements in the field. By integrating evidence into clinical decision-making, radiography can enhance patient care quality and maintain high practice standards.